As a nurse, what made you most uncomfortable when a patient took off their clothes? 1. As a nurse, we see naked bodies all the time. You've seen one, you've seen them all, so we like to say. However, there was one time, in particular, I was disturbed at what I saw. In the emergency room, people from all walks of life, from all different backgrounds come in to be seen. One day, a woman, who happened to be homeless, came in to be seen for a wound that would not heal. This woman seemed to take care of herself as best she could. You wouldn't have thought she was homeless at first glance. I said, "Okay, let's take a look." So she casually starts taking off her blouse. I asked her if she wanted me to leave the room. She said, "No, that's okay." Even though she asked me to stay, she seemed a little shy, and hung her head down in shame. I turned my back to give her some privacy. As usual, hospital staff try to make a person feel more comfortable by providing them with some kind of dignity, and maybe even throwing a corny joke in there. When she said she was ready, I turned around and asked her where the wound was. Exactly. She pulled down her gown, and her whole breast and half of her chest was eaten away from cancer. It smelled like death and looked even worse. I didn't expect the wound to look like this. We as hospital staff always have to keep a poker face, so that we don't make the patient feel bad. She then apologized about the smell and said to me, "I try to keep up with the smell as best I can, but it still stinks." I then reassured her as best I could. She told me she didn't know what it was and why it had spread the way it did. She said she wanted to get to the doctor sooner, but she didn't have health care insurance and didn't want to rack up any bills. My heart sank to my stomach. I told the doctor right away to please come in the room. I felt so bad knowing what it was right away, and now, as if she wasn't down on her luck already, we had to tell her what it was. That was sad. I felt so bad for her. 2. Many years ago, in England, I had a girlfriend who was training as a nurse. She was full of stories of objects and vegetables she'd seen people injure themselves sexually with, but one story reduced me to uncomfortable laughter. A man arrived in the emergency department one day and opened his raincoat. He was naked underneath. A milk bottle was attached to his gorged member and he couldn't remove it. The medical staff eventually had to break it, and yes, I can hear your sharp intake of breath as you imagine that moment. But how had the bottle got there? The man had the gall to explain that he had placed several empty milk bottles beside his shower cabin so as not to forget to put them out for the milkman afterwards. While taking a shower, he had slipped and fallen out of the cabin in such a way as to jam, accidentally, his penis in the bottle. His erection had occurred as a reflex. Yeah, sure. 3. As a nurse, the most uncomfortable situation arises when a patient unexpectedly disrobes, compromising their privacy and boundaries. It's vital to maintain professionalism, respect, and ensure the patient's dignity while addressing their immediate needs or concerns within the scope of medical care. 4. During my pediatric rotation in nursing school, we had a 2 or 3-year-old little girl admitted to my floor. She was assigned to me. She had been removed from her home, was in DHS custody. She had been given a little gown that didn't fit, it hung loose. As I approached her, I saw that she had no panties. She was already frightened, confused, traumatized. Was having her dignity taken as well? Oh, no, no way. I told her we had diapers, no pull-ups back then, she could use as panties, but she didn't want them. I called every floor central supply to try find some item to cover her bottom. Nobody had a single thing. Nobody could take a break right then to run to the store. The social worker said she would bring the girl some panties later. I found a few clean surgical caps, the ones with thin elastic, cut leg holes in them. That little girl was so happy. It broke my heart that any child had to be in such a bad situation. There was no excuse for that. None. 5. It was an elderly woman who had suffered the worst case of abuse and neglect I have ever seen. She was thin and covered in feces, but that wasn't by any means the worst of it. She had lice, hundreds of thousands of lice crawling all over her. Her hair looked dark brown and fairly thick until on closer inspection it could be seen to be Knit's empty eggs attached to the hair at 1 millimeter intervals over every hair on her head. I showered her wearing full body protection and mask. 2 colleagues spent hours with Knit combs on her hair. Her hair turned out to be gray and quite thin underneath. We didn't want to shave her head and have her suffer that indignity too. It took her days to speak a single word. I bought her fluffy slippers and a dressing gown as she had nothing. She eventually was placed in a nice nursing home. 6. I was working in an urgent care and this very religious looking lady, I'm gonna say Mennonite, possibly Amish, came in very sick, upper respiratory infection. Now this lady had long hair up in a bun, little wire framed glasses, no makeup, long sleeve plain blouse tucked into a skirt that almost touched the floor. She had to have a shot in the keister. I go in to give the shot. I asked the lady to drop her skirt because it would be easier than lifting it due to its length. She complied and I almost died right there. She was wearing a bright red leather thong. Exclamation mark. I composed myself, gave the injection and ran. Lamau. 7. The thing that made me most uncomfortable wasn't under the patient's clothes. I was assigned a patient who had just returned from an EEG, and since they used a white sticky paste to hold the electrodes on the head, you have to shampoo it all out of their hair when they got back. I had everything set up, including plenty of towels, shampoo, combs, etc. I got my patient to the sink, wet his hair and started working. I started with his right side and lathered it up well, and it took most of the gummy stuff out, but you still had to pick little pieces out with your fingers or comb. When the right side was done, I started working on the left side. I immediately knew something was wrong. The head was soft. I mean, no skull under the hair. No one prepared me for this, and I was only a student nurse. What if I shampooed too hard? Could I hurt his brain? I was panicking. My patient was so nice. He said, Didn't they tell you I had a hem craniostomy? They're leaving it open until they pinpoint what's wrong and then I'll get a plate. I told him how scared I was and he told a few jokes and his hair was clean. Poor guy, I think they were doing EEGs almost every day. Now that made me uncomfortable.